Health Canada has now authorized the use of an updated Moderna COVID-19 vaccine, and doses are expected to arrive in Canada very soon. As a matter of fact, within days, we expect. It's up to the provinces and territories to determine how the immunization rollout will go. In the meantime, the government's already asked provinces and territories to get rid of all of the old stockpiles, no more usage of the old vaccines, to make sure they're set for the new fall season and the new strains that are circulating. It's a good opportunity to touch base on what is happening, what is circulating. And Dr. Samir Gupta is with us this morning, a respirologist and associate professor at the University of Toronto in the Department of Medicine. Welcome back.
Thank you.
So we got this new approval for the new vaccine, Spikevax.
Yes.
What's different in this latest formulation?
Well, it's like we talked about last year at this time. It's about just upgrading the vaccine to match what's happening out there in the community with the virus. The virus is constantly evolving and changing, and so the vaccine needs to do the same so that the immunity it provides will protect you better against variants that are now circulating out there. So it's just like when you update your software on your phone. You know, your software is not bad, it's okay, we have some immunity, but why not get better immunity? Because what we have now is still part of the Omicron family, in particular a subvariant called JN1 and the subvariants that come from that one. And what changed with that one...
KP2 is something I've been hearing about that too.
KP2 is a subvariant of JN1. KP2 is the subvariant that these vaccines, the mRNA vaccines, were designed against. The Novavax was designed against JN1. They're all part of the same family. And what's different with JN1 is that it has a couple of mutations. One is that it allows the virus to bind more tightly to our cells. That makes it a bit more contagious, we think. The other is that it has mutations that enable it to better escape the immunity that we currently have. And so for those reasons, it has emerged as dominant, and it is able to infect people. And these newer vaccines elicit a stronger response to the currently circulating variants than last year's XBB vaccine. So
if you're keeping track.
These alphabet soup thing again.
Exactly. Yeah. But whatever is out there now, this is better formulated to tackle that. So as I mentioned, Moderna is going to be shipping this very soon, within a day or two, and it's up to the provinces and territories to decide the rollouts.
Yes.
But who should get it and when?
Great question. So most people, I think a lot of people, would have had a shot last year, an updated shot, sort of their fall shot, many times with the flu shot. The virus is not behaving like a proper respiratory seasonal virus.
We haven't got any patterns established yet, have we?
It's interesting. So. You know, we've hoped it would, and it would make it easier from a public health standpoint, but we're in a wave right now. We're in a late summer wave right now. So, and we do anticipate that it'll get worse as the weather gets colder, as people go indoors. So this is a time for people to get their shot, particularly if you're high risk, particularly if you're 65 plus, if you have a weak immune system, chronic conditions, pregnant women, people who live in nursing homes, congregate settings. Those are the highest risk people. For other people, it's still suggested, it's still recommended, but their risk of a severe disease, of a severe infection is lower to begin with. But I'm still recommending it to my younger, healthier friends and saying, why wouldn't you lower your risk of that severe infection, just like you would do with flu? And also lower your risk, by the way, of long COVID, which now 400 million people around the world suffer from long COVID. Lower your risk of what's called immune dysregulation, which is we're learning more and more about after a COVID infection, the immune system just getting weak for a period of time, which may be why we're seeing so many of these other infections we're talking about, like whooping cough and RSV and TB and fungus in some parts of the world. So lots of different effects from having a COVID infection, even if it's not severe.
So the recommendation then to consider, and the other thing you mentioned, the flu shot.
Yeah.
You can do them at the same time.
You
and
can.
we did. We talked about that last year.
Yeah.
And I did, in fact, do that. And it didn't have any, extreme, adverse effects. It was just, it was fine to get them both done at the same time. Interesting when you say there's a late summer wave. It's the numbers that are coming back, the lab tested numbers, or the PCR tests that are coming up, show a national average of 18% positivity. Yeah. It was 4% back in April. I mean, it's still out there. What is your read on the current status for COVID?
Yeah, so we don't have the Ontario wastewater data. We don't have as much data. We don't have as much central testing data. We have some federal wastewater data, and that suggests that we're in a moderate activity level. If you look at what's happening with hospital test positivity and Central Public Health Agency of Canada reported test positivity, like you say, 18%. 1 in 5 times someone is thinking about COVID and testing for it, it actually is COVID. That's very high. So we are in this late summer wave, and by some accounts, we're at levels in the community that are similar to the last time we had it in 2022, an Omicron wave. So, in a year and a half, 2 years, we haven't seen these numbers. Anecdotally, people will tell you, well, yeah, a lot of my friends are getting COVID, or a lot of my friends are getting sick, but not necessarily testing for COVID. So this is part of it. People are, it's out of sight, out of mind, but it's not, it's there. It's a virus that is still having an impact on people, having an impact on our healthcare system, because it's, again, not just a seasonal virus, it's happening at other times of year.
Okay, so watch for those details when the rollouts begin. In the meantime, helping us understand it's still out there. And, we should say, so Pfizer and Novavax, their latest iterations, we'll be looking at those because Health Canada is considering those as well.
Yeah.
Thanks, Dr. Gupta, as always, and we'll see you next week. Thanks.
Thank you.